During this time, most of us are inundated with information via social media, television, radio, and more. And we all know that we're supposed to stay home to stay healthy. But what if you don't have a home and you don't have access to internet, television, and radio? Well, with us to talk about the unsheltered community in Thurston County is Meg Martin from Interfaith Works. Hi, Meg. Thanks for joining us today.
Hi, so glad to be here.
So tell us, how has your routine changed with COVID-19?
Wow, so much has changed with COVID-19, to be honest. Running a congregant shelter for people who are considered to be in the highest risk category, over 60 years old, living with chronic illnesses. It's really changed our day to day. So about the second week of March, we transitioned our nightly shelter to a 24/7 shelter to encourage people to be able to shelter in place and stay where they are. And when that happened, we also instituted a really thorough health screening process every day. So we do mandatory fever checks and symptom checks for everybody that stays at our shelter. We also have increased protocol for staff safety. So that includes personal protective equipment, but also just sort of day-to-day protocols around sanitation, how to handle food, how to handle laundry. All of those things have shifted since COVID-19. And the biggest change has been that we opened a second shelter to be able to institute social distancing at our shelter downtown. So in order to do that, to put 6 feet between all of our bed spaces, we lost about 15 bed spaces in the basement of First Christian Church, where we've been operating since November of 2014. So we opened a second shelter up at 2828 Martin Way, and are also operating that 24 hours a day with meals delivered. So expanded, but also sort of downsized in some ways.
So you talked about a couple of shelters that you have operation. Don't you have other services that you provide, and are they different now? Have some of them been eliminated? Have some of them been added to?
Yeah, so we are one of the primary partners in the Providence Community Care Center, which is the day center and mental health clinic that is in downtown Olympia. And right around when all this was happening, all of the Providence facilities instituted certain changes to make sure for social distancing and to eliminate congregant programs. So, unfortunately, that meant that the community care center day room had to close. And that was a really difficult decision, I think, for everyone, because the community care center served between 200 and 300 people per day on average, and was the primary place for folks to get access to hygiene services in the city. So, when that decision was made, that's when we pivoted to go to 24-hour shelter, and tried to get creative solutions in place for how people could still remain getting access to vital hygiene services. So we've started shower shuttles and partnerships with other groups to be able to get folks that access. We also do have a case management program, and that has shifted a little bit. It's called the navigation team, but mostly they're just going out in the field to meet with people and coordinating appointments with clinical providers via phone, and just helping to break down some of the additional barriers that have been put in place, making it hard for people to access services.
So did the demand for the services you provide increase with the pandemic?
So yes, in some ways, in that the folks who are living unsheltered in our community, and those who are sheltered as well, we're sort of seeing the city shut down around them, right?
Mhm.
All the public bathrooms through the city and through the state were closed down. And so kind of every day there was more and more or yeah, more and more restriction of public spaces, of access to services. And so folks were coming to us and asking, where more of a demand about where people could get their basic needs met. We saw a demand of people trying to access shelter because they were scared to stay outside. And so definitely we haven't seen necessarily like an increase in homelessness from what we typically see in our community. But absolutely folks are really a lot more aware and concerned about lack of access to bathrooms, hygiene services, connecting with their services that now are going to phone and video only. A lot of people are struggling to know how to best get in touch.
So, in normal times, people could just walk up to the Providence Care Center if they needed help. Now, what do they do? Is there signage at that building with phone numbers? What do people do if they need your services?
Yeah, that's a great question. So there is signage at the building that's up with phone numbers, but access to a phone is not
Mhm.
always possible. So a few things have been happening. There's been a major increase in efforts to do outreach to people who are unsheltered and living in encampments or in doorways on the sidewalk. And so messages are getting delivered that way. There's been a very cool effort locally, a coalition of a bunch of service providers that call themselves the GROWL, the Greater Regional Outwork Outreach Workers League. They've been putting together a weekly digest that's like a printable pamphlet, basically about any services that have changed over the last week, how they can access different services, any new information about COVID-19 that might have come out. That's been something that's been really interesting and unfortunate to watch. A lot of the messaging that many of us are feeling. Um, overwhelmed with consuming every day isn't getting to people that are disconnected from social media or from media outlets. And so getting that word out to them is really important, just about what the virus is, how you get it, how you spread it, all of those things. So um, there's been a major increase in efforts in that way. And then we do have drop in hours at the nightly shelter between 5 and 9 p.m. at First Christian, where people can come to the gate and ask for supplies that they need. If we have extra food, also, a lot of people used the community care center as a mailing address. And so we are now able to get their mail and bring it to the nightly shelter, and then people can come pick up their mail every day there. So basically, just pivoting and being flexible to try to get people what they need.
Okay. Well, I know the people in the community would like to help. Are there things that they could do to help? Donations or volunteering?
Yeah, so volunteering, it's so unfortunate because a lot of people have extra time right now on their hands. Not everybody, but a lot of people do. But it's not, we're trying to minimize the amount of um, outside influence, I guess, in the shelter, and just really wanting to encourage the stay-at-home order. I mean, honestly, the one of the most supportive things people can do is honor the stay-at-home order, especially for the people who are staying in our shelters that are at highest risk. But that being said, absolutely, we are still needing people to be sewing cloth masks. We're doing a mask exchange. So we're encouraging people to turn their masks in every day so that we can launder them. So, in order to be able to give people clean masks each day, we have to have an inventory of that. So, sewing cloth masks and donating them, donating all the regular supplies that our shelter needs, which are up on our website, but it's blankets and bedding, clothing for adults, all sizes, all genders, um, emergency survival supplies like socks, batteries, uh, all kinds of, like flashlights and waterproof matches, tarps, things like that are all really useful for when we're doing outreach. But there's a more extensive list on our website if we're able to post it.
Okay. Well, we're going to let you go, but is there anything else you'd like to add before we do?
I think that what I would just like to add is that this is a really important time in our community to really see the gaps in the safety net that we have, and that during this whole thing, the thing that has really struck me the most is the fear and concern that we have heard from people who are experiencing homelessness in our community about being left behind. And it has been so amazing to see the outpouring of support and volunteerism and donations that we've had. And I hope that that spirit can continue on in whatever our future past COVID-19 looks like. The only way that I see that our community is really going to heal from this is to really see and understand everyone's unique experience during this time. And we have a real opportunity right now to let that really sink in. And so I'm grateful for the chance to get the word out. And thank you so much for having me.
Yeah. All right. Thanks for being on the show.
Yeah.
If you'd like to donate to the shelter, go to iwshelter.org to find out what they are in need of most. And you can bring those supplies to the First Christian Church from 5 to 9 p.m. Then call 360-918-8424 and a volunteer will come out to your car and get them from you. You can also make cash donations online at iwshelter.org. That's all we have for you today. Tune in next time for more updates. Again, if you have any questions or suggestions for something we should cover, send an email to rkam@tcmedia.org. Stay home, stay updated with Thurston Community Media, and stay safe, Thurston County.